In medicine, some of our greatest heroes are also, well, kind of the villains. They're these incredible tools that can do amazing things, but they come with a really serious dark side. Today, we're diving into one of the biggest ones, bupivacaine. It's a true double-edged sword. But first, let's just start with a basic question. I mean, really think about it. What does it actually take to just silence severe pain? Not for a minute, but for hours on end. We're talking about the kind of pain that comes with major surgery or childbirth. How do you just turn that off? Well, that very question gets right to the heart of a huge challenge in medicine. See, your body is hardwired to scream at you with pain signals when something is seriously wrong. And for doctors to do their work, to perform surgery, to help you recover, they needed a way to cut through all that noise and keep it quiet for a good long while. And it's not just about getting through the operation itself, right? The real healing, the real recovery starts afterward. And you can't really recover if you're in agony. So, a quick little numbing shot, that's just not going to cut it. The medical world needed something with some serious, long-lasting power. And so the search was on. And eventually, the world of anesthetics delivered. A new molecule appeared on the scene that was about to completely change the game for how doctors manage pain. Okay, so let's get a proper introduction. Meet bupivacaine. Now, technically, it's what's called an amide local anesthetic. That really just has to do with its chemical structure and how your liver breaks it down. But that's not the important part. Its real claim to fame, the thing that makes it so special, is just how incredibly long it lasts. And when I say long-lasting, I mean really long-lasting. We're talking 2, 4, sometimes even 8 hours or more, all from a single injection. It's got this unique chemical makeup that lets it kind of cling to your nerve tissues, holding on and blocking pain way longer than other anesthetics could ever dream of. So how does it actually do that? Well, the best way to think about it is like this. Imagine your nerve is an electrical wire, and it's carrying a pain signal straight to your brain. Bupivacaine comes along and acts like a circuit breaker on that wire. It literally goes in and temporarily blocks these tiny little gates on the nerve cell. They're called sodium channels, and just stops that electrical signal cold. No signal, no pain. It's as simple as that. Okay, but here's where it gets really, really clever. It has this feature called sensory motor separation. What that means is it's way better at blocking the small nerve fibers that carry pain than it is at blocking the big, beefy nerve fibers that control your muscles. Now, why is that so important? Well, think about a labor epidural. You want to block the mom's pain, absolutely, but you still want her to be able to push when the time comes. This separation makes that possible. It's just elegant. All right, so it's powerful, it's long-lasting, it's clever. It sounds pretty perfect, right? Well, this is where our story takes a dark turn. Because the very things that make bupivacaine so great, its potency, its stickiness, are also what make it so incredibly dangerous. With any powerful tool, there are risks. But with bupivacaine, the stakes are just on another level. An accidental mistake, like injecting it into a blood vessel, isn't just a minor oops. It can be absolutely catastrophic. And the reason for that risk has a name. It's called a narrow therapeutic index. It's a fancy term for a really simple and frankly pretty scary idea. It means the line between a dose that provides perfect pain relief and a dose that could be life-threatening is razor thin. It's a knife's edge that demands absolute precision from the clinician. So what happens if you cross that line? The body starts sending out warning signals, and they can escalate fast. First, the central nervous system gets hit. It might start with something weird, like a metallic taste in your mouth or ringing in your ears. Then, your vision might get blurry. Then come the muscle twitches, and from there, it can quickly spiral into a full-blown seizure. But that's not even the worst of it. This is the most chilling part. If a toxic dose gets to the heart, it can trigger cardiac arrest. And here's the problem. Because the drug binds so tightly to the heart's own sodium channels, and it lets go so slowly, standard resuscitation protocols often don't work. It's what's known as a difficult-to-resuscitate cardiac arrest, and it is an anesthesiologist's absolute worst nightmare. Okay, so hearing all that, you might be wondering, how on earth are doctors using this stuff every single day? If it's so dangerous, why is it still a cornerstone of medicine? Well, it all comes down to mastering that risk, using a deep understanding of the drug and some really smart strategies.
First and foremost, it's all about the dosing, and not just how much drug you give, but the concentration. For something like labor pain, a clinician would use a really low concentration, say 0.125%, to get that pain relief with minimal muscle weakness. But for a major surgery where you need a dense, complete block, they'd go for a much higher concentration, like 0.5%. And here's another really clever trick of the trade. Clinicians will often add a tiny, tiny amount of epinephrine, that's adrenaline, to the bupivacaine. This does four amazing things. One, it constricts blood vessels to keep the drug right where you want it. Two, that slows down its absorption into the rest of your body, which lowers the toxicity risk. Three, it actually makes the pain relief last even longer. And four, and this is the genius part, if you accidentally inject into a vein, the epinephrine causes a brief spike in heart rate, acting as an immediate warning sign. But the story of bupivacaine is still being written. The medical community saw these risks and said, we can do better. Scientists and chemists went back to the drawing board to figure out how to keep all the good parts of this drug while engineering out the dangerous parts. One of the first major breakthroughs came from a really cool bit of chemistry. It turns out the original bupivacaine molecule is actually a 50-50 mix of two versions that are mirror images of each other. Think of them like your left and right hand. Well, scientists figured out that one hand was responsible for most of the toxicity. So they isolated the other, safer hand and created a new drug called levobupivacaine. It has pretty much the same pain-blocking power, but with a much better safety profile. Now, if that was about changing the molecule, the next big leap was about changing the packaging. Meet liposomal bupivacaine. The idea here is to take the drug and wrap it up inside these microscopic little bubbles made of fat. These liposomes act like a time-release capsule, slowly leaking out the anesthetic into the surrounding tissue over a very long time. And the result of this technology? It's pretty incredible. A single injection during surgery can provide meaningful pain relief for 72 to 96 hours. Let that sink in. That's 3 to 4 days of pain control from one shot. Think about what that means for reducing the need for opioid painkillers after an operation. It's a total game changer. So, when you look at the whole story of bupivacaine, it's really the story of medical progress in a nutshell, isn't it? We start with this powerful but also risky breakthrough. Then, over time, we learn, we refine, and we innovate to make it safer and better. It leaves us with a critical question to think about for the future. As our tools become even more powerful, how will we continue to refine them to ensure that with great power always comes even greater safety?